When should we use somatic therapy instead of talk therapy? Well, let's first go over what is somatic therapy and talk therapy. So talk therapy is often used when something is dysfunctional or when we need to figure something out or process something and we need help making the best decision for us, right? Somatic therapy is actually less cognitive. Somatic therapy is when we are suffering physiologically and within the body. So if we think about, hey, I've been having difficulty sleeping or eating properly, or I've been having difficulty with anxiety, or I've been having difficulty with back pain. So anything that involves our body, right? I've been having large emotions. So I feel large emotions in my chest or tightness in my chest, or I feel grief or rage or anger or intense sadness. These things are things we can feel. So when we tap into talk therapy, it's important for how we can make better decisions or how we can understand some things, and we can bounce ideas off of a therapist. Talk therapy often includes CBT, which is like, hey, what is the evidence that I can find so that I can start thinking a little bit differently about my surroundings? So an evidence of whether I should get angry or not get angry. Well, what is the evidence around me supporting my reasoning for doing things, right? That's just a very slight, small explanation on CBT and talk therapy. When it comes to somatic therapy, it's, as we described before, it's sensations, it's feelings, it's emotions, it's addressing those big things that are really rattling our body. And conversely, on the other extreme, it's also addressing numbness and dissociation. So it's when our body is involved in this trauma response. When we want to use talk therapy and CBT, it's always a good idea to use both. So that's when we're looking to process something verbally, to understand something differently, to think about things differently, to reframe things. That's when we want to use talk therapy. We want to use somatic therapies when we want to address what's really going on in our body. And we'll notice that new ideas and ways of feeling and thinking about things will also come up when we have an experience with somatic therapy. So a small somatic exercise might be, hey, where do you feel the heaviest or the most intensely within your body right now? And you might say, well, maybe my brain, maybe my head, maybe my eyes, maybe my chest. And whichever part of your body that's coming up in, you can use your two hands to support that. And you can also use not only your hands, but your words to say, how can I describe this feeling? Is it heavy? Is it deep? Is it superficial? Is it tight? Does it have an emotion associated with it? Does it have a color associated with it? Maybe the emotion is sadness or anger. Maybe the color is red or blue. And as we continue to deeply feel into that space within the body, we'll notice memories and concepts and different things coming up that our body is communicating to us, which is being stored within that area. And that's how we work directly with the body. A somatic therapist might also invite you to touch into that part of your body and then to focus on something external and outside of your body that is a bit less charged. Or they might ask you, hey, I noticed that there's a heavy part of your body. Maybe you want to focus right now on a lighter part of your body, like your hair or your nose. And so that's also using different aspects of somatic therapies like pendulation or like increasing our tolerance for feeling certain emotions or feelings or sensations. So this is a huge question. I've touched very slightly on two really large topics, but I do think I've responded to the general question of when can we use somatic therapies versus talk therapy? And the response really is, it's awesome if we can do both. And specifically using somatic therapies when we are really wanting to work with heavy or deep or different types of emotions and feelings that we can sense within the body. And ultimately, doing these things with somatic therapies helps us to be able to process trauma in a different way, where however we are feeling, we are able to shift in and out of heavier and lighter emotions more seamlessly, and we are also able to accommodate new updated emotions that maybe before we weren't able to, such as trust or safety. I hope that sheds some light on these two huge topics. Thank you for joining me today, and see you again soon.